We need stronger evidence to understand how to best deliver general practice care to meet the needs of our population. And so that's what we're trying to look at the Centre for Future Health Systems. How do we fund general practice the best way to get the best health outcomes for patients? But importantly, how do we support GPs and practice teams to thrive and to be productive into the long term? Hi, I'm Dr. Michael Wright. I'm a GP, a researcher, a health economist, and I'm Associate Professor at the International Centre for Future Health Systems at the University of New South Wales, and I'm also the current President of the Royal Australian College of General Practitioners. I started off, did GP training, grew up in Queensland. I did my fellowship with the College of GPs over 20 years ago now, and spent the first 10 years of my clinical career working as a GP with my dad, who we had a practice together in Queensland. After Dad passed away, sadly, I thought I might want to do a bit more research, and I had the opportunity to move to the UK, did my Masters in Public Health and Health Economics at the London School of Hygiene and Tropical Medicine in the UK, and at that time thought I'd never do a PhD, but fast forward 5 years and I then did my PhD in Health Economics at the University of Technology in Sydney. And then for the last 2 years, I've been based at the University of New South Wales in the International Centre for Future Health Systems. I've always been interested in general practice research, and then the health economics side of research, particularly as it pertains to primary care. And then I've recently taken on the role as National President of the Royal Australian College of General Practitioners. I felt there was a real need to increase the awareness of the value that general practice provides to our health system, and to bring some greater understanding of the economic impacts and the benefits that general practice provides to our community. In terms of my research interests, so my background is a GP, so I'm really interested in understanding how we deliver the best quality care we can, but also how the value of GPs and the value of general practice gets better recognised. And that includes research looking at the value of continuity of care, which was the subject of my PhD. And then, given my additional research was into health economics, I'm driven to understand better value. So try to understand how do we get the best value for money out of the care that we're provided. But particularly as a GP, I see we spend a lot of money in hospitals and in non-primary care settings when a lot of that care could be provided in the community. So looking at how we develop models to safely provide care in the community within a multidisciplinary care team is my other area of prime interest. At the International Centre for Future Health Systems, a lot of our work is trying to understand how can we better design a health system that gets the best health outcomes for patients. We know that there are real challenges, and that the percentage of the health budget which has been going into general practice has been decreasing for most of the last decade, and we need stronger evidence to understand how to best deliver general practice care to meet the needs of our population. And so that's what we're trying to look at the Centre for Future Health Systems. How do we fund general practice the best way to get the best health outcomes for patients? But importantly, how do we support GPs and practice teams to thrive and to be productive into the long term? My dad was a GP, and I grew up seeing the value of general practice to the patients firsthand. And so my PhD particularly focused on the value of continuity of care in general practice, and fundamentally that still drives me. We know that patients who have a regular GP who knows them have better health outcomes than people who don't. And so I'm driven to try and set up a health system that helps people to see someone who knows them and to access the care they need from someone who knows them well. Given I'm now the president of the RACGP, I have limited downtime at the moment. There's a bit of travel in that role, so that's letting me see sort of a few different parts of Australia, but I'm really focused on that work at the moment, along with this work at UNSW at the International Centre for Future Health Systems.